If you think your dog's bad breath is just a normal dog thing, you might be ignoring a ticking time bomb that is slowly hurting their heart and kidneys. Most pet owners assume a smelly mouth is just part of the package when you get a dog. But that smell is actually the sound of an alarm bell going off. Did you know that by the time most dogs are 3 years old, about 80% of them already have some form of dental disease? That is a massive number. Imagine if 8 out of 10 people you knew had rotting teeth or infected gums. We would call that a health crisis. But with our dogs, we often just look the other way because they don't complain. Dogs are incredibly good at hiding pain. It is a survival skill they kept from their wild ancestors. In the wild, if you show that you are hurting, you become a target. So, your dog might be walking around with a toothache that would put a human in the emergency room, and they will still wag their tail and try to play. The real problem isn't just a lost tooth or a bit of pain when they chew. The mouth is the gateway to the rest of the body. When a dog has gum disease, their mouth becomes a factory for nasty bacteria. Every time they chew or even swallow, those bacteria can enter the bloodstream. From there, it is a straight shot to the heart, the liver, and the kidneys. There are countless stories of older dogs who were acting sluggish and old, but once they had their bad teeth fixed, they acted like puppies again. It wasn't old age slowing them down. It was a constant, low-grade infection draining their energy. Today, we are going to look at 7 specific signs you need to watch for right now so you can stop this process before it causes permanent damage. Let's talk about the first and most obvious sign, the smell. We all joke about dog breath, but healthy dog breath shouldn't actually make you want to pass out. If your dog licks you and the smell lingers on your skin like a pile of rotting garbage, that is a major red flag. This isn't just about what they ate for lunch. That foul odor is usually caused by metabolic waste from bacteria. These bacteria live in the film on their teeth and under the gum line. They produce sulfur compounds that smell exactly like something is decaying because, well, something is. Pay close attention to the specific type of smell. If it smells like rotting meat, that is usually a sign of infection or heavy tartar. However, if your dog's breath smells strangely sweet or fruity, that could actually be a sign of diabetes. If it smells like urine, it might mean their kidneys are struggling to filter out waste. Your dog's mouth is a window into their internal health. Don't just buy a box of minty treats and hope for the best. Those treats often just mask the smell without fixing the rot underneath. If the smell is strong enough to notice from a foot away, it is time to lift the lip and see what is going on. The red line of trouble. The second sign is something you can see if you just lift your dog's upper lip. Look at where the teeth meet the gums. In a healthy dog, those gums should be a nice, healthy pink, sort of like the color of bubble gum. If you see a bright red line right along the edge of the teeth, that is gingivitis. This is the very first stage of periodontal disease, and it is the only stage that is truly reversible. Think of that red line like a fire. It means the body is sending extra blood to the area to try and fight off the bacteria that are digging into the gums. If you catch it here, you can often fix it with a good professional cleaning and better brushing habits at home. But if you ignore it, the gums will start to recede. They will pull away from the tooth, creating little pockets. These pockets are like caves for bacteria to hide in, where your toothbrush can't reach them. If you see blood on their chew toys or if their gums bleed a little when you touch them, that is a sign that the tissue is fragile and infected. Gums should not bleed. If your own gums bled every time you ate a piece of bread, you would be at the dentist the next morning. Our dogs deserve that same level of concern. The third sign is the buildup of plaque and tartar. Plaque is that sticky, clear film that forms on your teeth after a meal. If you don't brush it away, it mixes with the minerals in the dog's saliva and hardens into tartar, also known as calculus. You will see this as a yellow or brown crust, usually starting on the back molars. This tartar is like armor for bacteria. It gives them a safe place to grow and multiply. As the tartar gets thicker, it pushes under the gum line and starts destroying the bone that holds the tooth in place. I once saw a dog where the tartar was so thick it was actually acting like a bridge, holding 3 loose teeth together. When the vet cleaned the tartar away, the teeth just fell out because there was no bone left to hold them. If you see brown barnacles on your dog's teeth, that is a sign that the infection is already deep and working its way toward the root. The fourth sign is a change in their eating habits. This one is tricky because dogs love food so much they will often eat through the pain. But you might notice small things. Does your dog suddenly prefer soft food over their hard kibble? Do they drop pieces of food while they are eating? Maybe they tilt their head to one side so they can chew only on the left side of their mouth. People often tell me, "My dog can't be in pain because he's still eating." But think about it, if you were starving and had a toothache, you would still find a way to eat, right? You would just eat carefully. You might also notice your dog getting picky. Maybe they used to love their hard nylon bones or dental chews, but now they just sniff them and walk away. That is a huge clue. If your dog stops wanting to chew on things they used to love, it's probably because the pressure of chewing is sending a sharp pain through their jaw. This isn't a loss of interest, it's a fear of pain. The fifth sign is a behavioral one. Have you noticed your dog pawing at their mouth or rubbing their face against the side of the couch more than usual? Sometimes we think they are just itchy or have a bit of a messy face, but this can be a sign of a throbbing toothache. Imagine having a migraine or a sharp pain in your molar. You would probably rub your temple or your cheek to try and dull the sensation. Dogs do the same thing. They use their paws or furniture to apply pressure to the area that hurts. They might also become head shy. This means they flinch or pull away when you try to pet them near their muzzle. If your sweet dog suddenly gets grumpy when you touch their face, don't take it personally. They aren't being mean. They are protecting themselves from a zap of pain. It's their way of saying, "Please don't touch that, it really hurts." The sixth sign is an increase in drooling or finding blood in strange places. Some breeds, like bloodhounds or Newfoundlands, are naturally drooly. But if your dog isn't usually a big drooler, and suddenly they are leaving wet spots on the carpet, pay attention. When the mouth is irritated or infected, the body produces more saliva to try and wash the area clean. This saliva might be thicker or ropier than usual. Even more concerning is finding blood. You might see a pinkish tint in their water bowl, or little red spots on a white rope toy. Sometimes you might even see blood on their bedding. This usually happens because the gums are so inflamed that the slightest pressure causes them to weep blood. This is a sign that the infection is quite advanced. In some cases, you might even see a swelling under one of their eyes. This is often a tooth root abscess. If your dog won't let you near their mouth with a brush, start slow. Use your finger with a little bit of the tasty paste and just let them lick it. Then slowly work up to rubbing their teeth. There are also water additives and dental powders that can help break down plaque if your dog is particularly difficult. But the gold standard is always a professional cleaning by a vet. This is where they put the dog under anesthesia so they can clean deep under the gum line where the real damage happens. It can be expensive, but compared to the cost of treating heart failure or kidney disease later on, it is a bargain. Your dog counts on you to be their health advocate. They can't tell you when their mouth hurts, and they can't brush their own teeth. By catching these 7 signs early, you aren't just saving their teeth. You are protecting their heart, their energy, and their ability to enjoy life with you for as long as possible. Check your dog's mouth today. It only takes 10 seconds, but it could change everything for them. Watch this next video to learn the best way to brush your dog's teeth without the struggle.